beneficial active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle: 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional: monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝑭𝒂𝒄𝒊𝒂𝒍 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation, irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1,000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils cause hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly, Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, full treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. the skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. 𝑦𝒂𝒄𝒊𝒂𝒍 fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, 𝑭𝒂𝒄𝒊𝒂𝒍 is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma (PRP) therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive, laser treatments $500 to $1,500 per session, multiple sessions required. Microneedling is more affordable at $200 to $400 per session. Fillers vary based on amount needed. Insurance typically doesn't cover cosmetic scar treatment. Discussing cost with your dermatologist and potentially planning treatment over time is reasonable. Home care between professional treatments supports improvement. Proper sun protection prevents hyperpigmentation that makes scars more noticeable. Hydration and appropriate skincare support skin healing. Some evidence suggests that certain topical ingredients like retinoids and vitamin C might provide modest scar improvement through collagen support, though these effects are minor compared to professional treatments. Scar appearance often improves naturally over years. Post-inflammatory changes gradually fade. Scars that seem severe initially might improve significantly over 12 to 24 months even without treatment, though active treatment accelerates improvement. Guide 32. Environmental and occupational factors influencing acne. Acne development isn't purely internal. Environmental and occupational factors significantly contribute to breakouts. Understanding these external factors allows you to modify your environment and workplace practices to support stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98. Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatments insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68. Acne in older adults, age-related changes and treatment adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is more sensitive to irritation and barrier compromise than younger skin. Acne treatments tolerated well at 20 might be too irritating at 50. Gentler approaches and more aggressive moisturizing are often necessary. Skin barrier function naturally declines with age, requiring more careful barrier support during acne treatment. Sensitive skin becomes more common with age. Menopausal acne related to estrogen decline often requires hormonal approaches, hormone replacement therapy or other hormonal management, rather than relying solely on topical treatments. Dryness is more common with age and often worsens with acne treatments. Aggressive moisturizing becomes increasingly important with age. Combining anti-aging skincare with acne treatment becomes relevant in older adults. Using retinoids addresses both acne and aging simultaneously, though barrier support becomes more important. Sun damage accumulated over decades makes older adults more susceptible to post-inflammatory hyperpigmentation and other post-acne complications. Extra sun protection is crucial. Taking medications for various age-related conditions, blood pressure medications, cholesterol medications, etc., increases medication-acne interaction risks. Discussing acne treatments with healthcare providers familiar with your complete medication list is important. Guide 69. Acne Severity Scoring and Objective Progress Measurement. Objectively measuring acne severity and progress helps distinguish real improvement from perceived improvement and guides treatment adjustments. Several acne severity scoring systems exist. The Global Acne Grading System, GAGS, assesses lesion counts and types in different facial regions, providing an objective severity score. The Investigator Global Assessment, IGA, uses clinical judgment to rate severity on a scale. Various others exist with different approaches. Lesion counting helps objectively track progress. Counting comedones, blackheads and whiteheads, inflammatory papules, and pustules weekly or monthly provides objective data showing whether acne is improving. Photography provides visual documentation of progress. Taking consistent photos, same lighting, same angle, same time of day, monthly allows comparison showing improvement that might not feel obvious during the journey. Apps and digital tools can help track lesion counts, take comparison photos, and document progress over time. Severity scoring helps determine whether treatments are working and justify continuing them. If you're using a treatment and lesion counts aren't decreasing after 8 to 12 weeks, this objective data helps justify trying different treatments rather than continuing ineffective approaches. Baseline severity assessment establishes starting point for treatment. Knowing whether you started with mild, moderate, or severe acne contextualizes improvement. Someone improving from severe to moderate acne shows real progress even if not completely clear. Long-term tracking shows patterns, whether acne is generally improving, stable, or worsening over months. This helps distinguish temporary fluctuations from trends. Showing objective improvement to healthcare providers demonstrates treatment effectiveness and justifies continuing treatments or pursuing additional interventions. Guide 70, Acne and Physical Activity, Exercise Benefits and Sweat Management. While exercise's acne-triggering potential through sweating is often emphasized, the overall benefits of exercise for acne typically outweigh risks. Understanding how to exercise safely while managing sweat-related acne allows enjoying exercise benefits without acne worsening. Exercise benefits acne through multiple mechanisms: stress reduction, stress hormones worsen acne, improved sleep, critical for skin health, improved circulation, nutrient delivery to skin, hormonal regulation, particularly in women, and improved overall health. These benefits typically outweigh acne risk from sweat. Sweat itself doesn't cause acne. Bacteria combining with sweat, sebum, and dead skin cells in clogged pores causes acne. Managing sweat through hygiene and clothing prevents sweat-related acne. Sweating during exercise increases bacteria and creates moist environment promoting bacterial growth. However, showering within 1 to 2 hours after exercise removes sweat and bacteria before significant growth occurs. Wearing breathable, moisture-wicking clothing reduces sweat accumulation and bacterial growth compared to cotton or tight, non-breathable clothing. Avoiding touching your face during exercise prevents transferring sweat and bacteria to your face and spreading existing bacteria from your hands. Sports bras and tight athletic tops can cause friction and occlusion-related acne in those areas. Ensuring equipment is clean and fits properly reduces friction acne risk. Increasing hydration during exercise supports overall health and skin health. Well-hydrated skin functions better than dehydrated skin. Post-exercise cleansing is crucial. Showering or at least cleansing your face and areas covered by equipment prevents sweat and bacteria from sitting on skin for extended periods. The net effect of regular exercise is almost always positive for acne despite sweat concerns. The stress reduction, sleep improvement, and hormonal benefits typically outweigh sweat-related acne risks. Don't avoid exercise due to acne concerns. Instead, manage post-exercise hygiene properly. Guide 71, Adapting Acne Treatment for Different Body Locations. Acne appearing on different body areas often requires treatment adaptation due to different skin characteristics and environmental factors across body regions. Facial acne, forehead, cheeks, nose, chin, is most common and receives most treatment attention. Facial skin typically tolerates stronger treatments better than body skin. Back acne, acne on chest and upper back, is common in males and can be severe. Body skin is thicker than facial skin and often tolerates stronger treatments. Back acne often involves larger lesions and deeper inflammation. Shoulder acne results from friction, bra straps, sweat accumulation, and clothing occlusion. Treatment combines friction reduction, sweat management, and topical treatments. Buttock acne results from friction from sitting, tight clothing, and occlusion. Prevention focuses on wearing loose, breathable clothing and good hygiene. Topical treatments similar to face can be used. Armpit/axilla acne results from sweat accumulation, friction from deodorants and antiperspirants, and occlusion. Gentle hygiene and avoiding irritating products help. Neck acne requires careful treatment as neck skin is thin and sensitive. Gentle treatments appropriate for sensitive facial skin are often better tolerated than stronger treatments. Scalp acne, acne on hairline and scalp, involves hair follicles and is often fungal or bacterial. Antifungal or antibacterial scalp treatments help. Keeping scalp clean, using clean hair products, and avoiding overly oily scalp conditions helps. General principle: treat body acne similarly to facial acne but account for thicker skin on body, can often tolerate stronger treatments, and friction/occlusion factors. Hygiene is even more important for body acne due to sweat and clothing occlusion. Guide 72, Acne Treatment and Athletic Performance. Does acne treatment affect athletics? Some athletes worry that acne treatments affect athletic performance. Understanding whether treatments impact performance helps athletes make informed treatment decisions. Benzoyl peroxide and salicylic acid don't directly affect athletic performance. These topical treatments have minimal systemic absorption. Tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36, Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal, weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare complications include elevated potassium levels that can affect heart rhythm. Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mild. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。𝑭𝒂𝒄𝒆はその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に計った、午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、ＫＯＯの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはＫＯＯの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。ＫＯＯは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、ＫＯＯは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がゐと呼ぶスタイルだ。何の用だ。威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフもはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42. Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43. Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, salicylic acid formulations meant to be applied to specific areas or the entire face, typically 2 to 3 times weekly. They're left on the skin and provide significant exfoliation. These are powerful products best used by those with resilient, acne-prone skin who have already adapted to gentler salicylic acid products. Spot treatments apply high concentrations of salicylic acid directly to individual breakouts for targeted treatment. These are excellent for treating isolated pimples without exfoliating your entire face. Starting with salicylic acid requires a conservative approach. If you've never used it before, begin with a 0.5% cleanser or 1% toner used 2 to 3 times weekly. Use it for 2 to 3 weeks, assessing your skin's response. If your skin tolerates it well without excessive irritation, dryness, or sensitivity, you can increase frequency to daily use or switch to a higher concentration product. When applying salicylic acid toners or serums, use clean fingertips or a cotton pad to apply evenly across your face, focusing on areas prone to acne. Use about a nickel-sized amount for your entire face. Apply to completely dry skin. Applying to damp skin increases irritation. Allow the product to dry completely before applying other products. Some salicylic acid products are meant to stay on your skin indefinitely, while others are meant to be rinsed off after a specific time. Read instructions carefully. Common mistakes when using salicylic acid include starting with too high a concentration, using it too frequently, combining it with too many other actives, and failing to moisturize adequately afterward. Starting with 2% and using it daily will almost certainly cause excessive irritation, dryness, and peeling. You're much better served starting gently and gradually increasing. Never combine salicylic acid with benzoyl peroxide on the same evening initially. Both are exfoliating actives that can cause significant irritation if used together by someone whose skin isn't accustomed to strong treatments. Once your skin has adapted to each individually, you might combine them cautiously, but build up to this gradually. Salicylic acid makes your skin more sun-sensitive, not severely, but notably. Always use SPF 30+ sunscreen daily when using salicylic acid. This is not optional. Sun exposure can cause post-inflammatory hyperpigmentation in acne-prone skin, and salicylic acid increases this risk. Side effects of salicylic acid are generally mild and resolve with time or reduced usage. Dryness is common, particularly if you're using higher concentrations or frequent applications. Combat dryness by using a good hydrating moisturizer immediately after applying salicylic acid. Mild peeling is normal and actually desirable. It indicates exfoliation is occurring. However, severe peeling suggests you're using too much. Slight irritation and redness may occur initially but typically resolve within 1 to 2 weeks. Some people experience temporary worsening of acne as impurities are brought to the surface, but this purging phase is usually short-lived. Results from salicylic acid appear gradually. After 2 weeks of consistent use, you might notice smoother texture. After 4 weeks, you should see reduced comedones and fewer new breakouts. Most people see significant improvement after 6 to 8 weeks of consistent use. However, salicylic acid works best for comedonal acne, blackheads and whiteheads, and mild inflammatory acne. For severe inflammatory or cystic acne, combining salicylic acid with other treatments like benzoyl peroxide or prescription retinoids is often necessary. Salicylic acid is safe for long-term use. Many people successfully maintain clear skin using salicylic acid indefinitely as their primary exfoliation and treatment method. However, occasionally, skin can become desensitized to salicylic acid if used continuously for extended periods. If you notice that salicylic acid that previously worked well seems less effective, take a 1 to 2 week break, then resume using it. This often restores its effectiveness. Alternatively, you can rotate between salicylic acid and other exfoliants like glycolic acid to prevent desensitization. Guide 5. Benzoyl peroxide, Comprehensive Guide to Bacterial Killing and Inflammatory Acne Treatment. Benzoyl peroxide is one of the most effective and widely recommended acne treatments by dermatologists. Unlike salicylic acid, which primarily removes dead skin cells and excess oil, benzoyl peroxide specifically targets the acne-causing bacterium 𝑭𝒂𝒄𝒊𝒂𝒍 acnes. Understanding benzoyl peroxide's mechanism, concentrations, and proper application is crucial for maximizing its effectiveness while minimizing side effects. Benzoyl peroxide works through a unique mechanism. It generates reactive oxygen species that directly kill bacteria. This is fundamentally different from antibiotics, which the bacteria can develop resistance to. Bacteria cannot develop resistance to benzoyl peroxide because it works through oxidative stress rather than targeting specific bacterial proteins. This makes benzoyl peroxide an invaluable tool in acne treatment, particularly since antibiotic resistance is an increasingly serious problem in dermatology. Beyond bacterial killing, benzoyl peroxide has anti-inflammatory effects, helping reduce the redness and swelling associated with inflammatory acne. It also has mild sebum-reducing properties and may help with some degree of comedone reduction, though it's less effective for this than salicylic acid. Benzoyl peroxide comes in concentrations ranging from 2.5% to 10%, with some over-the-counter products going up to 10% and prescription-strength versions available at higher concentrations. Interestingly, studies show that 2.5% benzoyl peroxide is roughly equivalent in effectiveness to 10% benzoyl peroxide. The higher concentration doesn't necessarily mean better results. It primarily means more potential for irritation. Therefore, it's prudent to start with 2.5% and only increase concentration if needed. Benzoyl peroxide comes in multiple product formats. Cleansers containing 2.5 to 5% benzoyl peroxide gently incorporate this ingredient into your daily cleansing routine. These are appropriate for maintenance or mild acne. Spot treatments allow you to apply high concentrations directly to individual pimples. Serums or leave-on treatments apply benzoyl peroxide across your entire face and are left on the skin. These can be used daily or as directed. Gels and creams are thicker formulations that may have different absorption characteristics depending on your skin type. Starting with benzoyl peroxide requires similar caution as salicylic acid. If you're new to benzoyl peroxide, begin with a 2.5% product, ideally in a cleanser format or spot treatment, used once daily. Most people find evening application easier than morning application since benzoyl peroxide doesn't require sun protection and can be easily washed off in the morning. After 1 to 2 weeks, assess your skin's tolerance. If you're experiencing mild irritation or dryness but your acne is improving, continue. After 2 to 3 weeks, if your skin tolerates the product well, you can increase frequency to twice daily or increase the concentration to 5%. Application technique is critical. Apply benzoyl peroxide to completely clean, completely dry skin. This is more important with benzoyl peroxide than with most other products. If your skin is even slightly damp, benzoyl peroxide will irritate more readily. Allow your cleanser to fully absorb and dry, then apply benzoyl peroxide. Use a small amount, about the size of a pea, for your entire face if using a leave-on product, or a slightly larger amount for spot treatment. Apply gently, allowing the product to absorb fully before applying other products. Benzoyl peroxide has a particular drawback: it bleaches fabrics and hair. If you apply it to your face, it can bleach your pillowcase, bedding, towels, and hair. Many people apply benzoyl peroxide in the evening and wash it off in the morning with their cleanser to avoid this issue. If you apply it in the morning, be extremely careful not to get it on your hair, eyebrows, or any colored clothing. Some people apply it as a spot treatment right before bed, allowing it to work overnight before being washed off in the morning. If bleaching is a concern, you might prefer using benzoyl peroxide in a wash-off cleanser format where the contact time is brief. Side effects of benzoyl peroxide are generally more significant than salicylic acid. Dryness is very common, particularly with higher concentrations or frequent applications. Combat this by using an excellent moisturizer after applying benzoyl peroxide. Some people find that benzoyl peroxide dries their skin excessively even at 2.5% concentration. If this is you, try reducing frequency to every other day or using it only as a spot treatment. Irritation and redness are common, particularly when starting benzoyl peroxide or when increasing concentration. This irritation is usually temporary and subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, dermatitis, or reactions, discontinue use and consult a dermatologist. Contact dermatitis to benzoyl peroxide, while rare, does occur. If you develop an itchy rash that doesn't improve with reduced frequency, you may be allergic. Discontinue use and inform your dermatologist. Many people experience acne purging when starting benzoyl peroxide, temporary worsening of acne as bacteria die off and impurities are brought to the surface. This purging typically lasts 1 to 2 weeks. If purging lasts longer, consult your dermatologist. Photosensitivity is not a significant issue with benzoyl peroxide like it is with some other acne treatments, but you should still use sunscreen daily for general skin protection. Benzoyl peroxide is particularly effective for inflammatory papules and pustules, the classic red pimples with white centers. It's less effective for comedonal acne, blackheads and whiteheads, where salicylic acid is superior. Many dermatologists recommend combining benzoyl peroxide with salicylic acid for comprehensive acne treatment. Use salicylic acid to address comedones and exfoliate, and benzoyl peroxide to kill bacteria and reduce inflammation. Results from benzoyl peroxide appear relatively quickly. Appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45: Nanotechnology in Acne Treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46: Environmental and Climate Adaptation Strategies for Acne. Acne management must adapt to different climates and environmental conditions. understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection, sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50, Acne Success Stories, Effective Patterns, and Realistic Timelines for Clear Skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves Guide 1, Complete Understanding of Acne, Pathophysiology, Types, and Root Causes. Acne is one of the most prevalent skin conditions affecting approximately 85% of people aged 12 to 24, with significant numbers also experiencing adult acne. To effectively treat acne, you must first understand its underlying mechanisms and various manifestations. Acne develops through a complex process involving 4 primary factors: increased sebum production, follicular hyperkeratinization, colonization by Cutibacterium acnes bacteria, and inflammation. The sebaceous glands, which produce sebum or skin oil, become hyperactive primarily due to hormonal stimulation. During puberty, androgens like testosterone trigger increased sebum production. This oil production is essential for skin protection, but excess sebum creates an environment conducive to acne development. The sebaceous glands have androgen receptors, meaning individuals with heightened sensitivity to hormones or with hormonal imbalances experience excessive sebum production. Follicular hyperkeratinization refers to the abnormal shedding of skin cells lining the hair follicle. Normally, dead skin cells shed and exit through the hair follicle to the skin surface. In acne-prone individuals, these cells stick together and don't shed properly, creating a plug within the follicle. This plug, combined with sebum, forms an ideal environment for bacterial growth and acne formation. Cutibacterium acnes, previously known as Propionibacterium acnes, is a naturally occurring bacterium on human skin. However, in the oxygen-poor environment created by plugged follicles, this bacterium proliferates rapidly. These bacteria produce enzymes and toxins that trigger the immune system, causing inflammation and the visible acne lesions you see on your skin. Inflammation is the final component and arguably the most visible aspect of acne. When the immune system responds to bacterial presence and follicle rupture, it sends inflammatory cells to the area, causing redness, swelling, heat, and the formation of pustules or nodules. Understanding this process is crucial because different acne treatments target different components of this mechanism. There are numerous acne types, each requiring different treatment approaches. Non-inflammatory acne includes blackheads and whiteheads. Blackheads, or open comedones, form when a follicle is clogged with sebum and dead skin cells, but the pore remains open. The dark appearance results from oxidation of the sebum, not dirt. Whiteheads, or closed comedones, occur when the follicle is completely sealed, trapping sebum and dead cells beneath the skin surface, creating a small white or flesh-colored bump. Inflammatory acne is more noticeable and potentially scarring. Papules are small, firm, red bumps without a visible center, representing the body's inflammatory response. Pustules are similar to papules but contain a visible yellow or white center filled with pus. These are the classic pimples most people recognize. Nodules are larger, deeper, solid lesions that develop when inflammation extends deeper into the skin. They're typically painful and can last for weeks. Cystic acne represents the most severe form, where large, fluid-filled lesions develop deep within the skin. These are extremely painful and highly prone to causing permanent scarring. Several factors contribute to acne development beyond just hormones and bacteria. Genetics play a significant role. If your parents had severe acne, you're more likely to experience it too. Environmental factors matter considerably. Living in humid climates can exacerbate acne due to increased moisture promoting bacterial growth. Pollution and environmental toxins can clog pores and trigger inflammation. Stress hormones like cortisol increase sebum production and inflammation, explaining why acne often worsens during stressful periods. Diet influences acne more than previously thought. High glycemic foods rapidly spike blood sugar, causing insulin surges that trigger sebaceous gland stimulation and androgen production. Dairy products, particularly skim milk, contain hormones and proteins that may trigger acne in susceptible individuals. Omega-3 fatty acid deficiency promotes inflammation, while excessive omega-6 consumption without sufficient omega-3s creates an inflammatory imbalance. certain medications, including corticosteroids and lithium, are known to trigger or worsen acne as a side effect. Recognizing your specific acne type and identifying contributing factors is the first step toward effective treatment. Some people have purely hormonal acne, while others struggle with bacterial acne, dietary triggers, or environmentally influenced breakouts. Understanding your personal acne profile allows you to select treatments targeting your specific problem rather than wasting time and money on ineffective solutions. Guide 2: Comprehensive Daily Cleansing and Preparation Routine for Acne-Prone Skin. The foundation of any successful acne treatment regimen is an appropriate cleansing routine. Many people underestimate the importance of proper cleansing, believing that any soap will suffice. However, for acne-prone skin, the cleansing process is far more nuanced and critical to success. Your cleansing routine will prepare your skin for treatment products and remove substances that promote acne formation. Begin by understanding that you should cleanse your face twice daily, once in the morning and once at night. Morning cleansing removes the oil, dead skin cells, and bacteria that accumulate overnight while you sleep. Your skin is active at night, producing more sebum and shedding dead cells, so morning cleansing is not optional. Evening cleansing is equally important, removing makeup, environmental pollutants, dirt, excess oil, and dead skin cells accumulated throughout the day. Many people neglect evening cleansing or do it hastily, significantly compromising their acne treatment results. Temperature matters more than most people realize. Always use lukewarm water, never hot water. Hot water strips away your skin's natural oils and disrupts the skin barrier, leading to increased irritation and compensatory sebum overproduction. Excessively hot water also causes blood vessel dilation, temporarily increasing inflammation and making acne appear worse. Conversely, cold water doesn't effectively remove oil and impurities, leaving your skin inadequately cleansed. Selecting an appropriate cleanser is crucial. For acne-prone skin, choose a gentle, pH-balanced cleanser specifically formulated for this skin type. The pH of your skin is approximately 4.5 to 5.5, slightly acidic. Using alkaline soaps disrupts this pH balance, damaging your acid mantle and increasing sensitivity and bacterial overgrowth. Look for cleansers labeled pH-balanced or for acne-prone skin. Many quality acne cleansers contain salicylic acid, a beta-hydroxy acid that penetrates into pores to dissolve sebum and dead skin cells. A concentration of 0.5% to 2% is appropriate for daily cleansing. Some people prefer cleansers with benzoyl peroxide, which kills acne-causing bacteria. A 2.5% benzoyl peroxide cleanser is effective without excessive drying when used in a cleansing format rather than as a leave-on treatment. Others prefer gentle, fragrance-free cleansers without active ingredients, particularly if their skin is sensitive or if they're using other strong acne treatments. Experiment to find what works best for your skin, understanding that what works for your friend may not work for you. The cleansing process itself requires attention to technique. Wet your face thoroughly with lukewarm water to open your pores slightly and soften your skin. Apply your cleanser using your fingertips or a soft washcloth. Using your hands is often preferable because you have better control and can feel whether you're applying too much pressure. Gently massage the cleanser into your skin using circular motions for approximately 30 to 45 seconds. This duration gives the cleanser time to dissolve oil and loosen impurities without overstripping your skin. Pay special attention to your T-zone, your forehead, nose, and chin, where sebum production is typically highest. However, don't neglect other areas, particularly your jawline and cheeks where hormonal acne often appears. Be especially gentle around your eyes and lips where skin is thinner and more sensitive. Never use a rough scrub or washcloth, as physical abrasion can irritate acne lesions, spread bacteria, and increase inflammation. After thoroughly massaging, rinse your face completely with lukewarm water. Ensure you remove all cleanser residue, as leftover cleanser can irritate your skin and interfere with the absorption of treatment products. Pat your face gently dry with a clean, soft towel. This is important. Never rub your face dry aggressively. Aggressive rubbing irritates inflamed acne, increases inflammation, and can spread bacteria to other areas of your face. Anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. Lipohydroxy acid is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28, Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much as I do, and those who matter don't judge me based on temporary skin condition." This isn't denying acne reality but maintaining perspective. Social support is protective. Talking with friends, family, or support groups about acne-related stress reduces isolation.